Okay, let's get into this. When we think about pressure changes affecting the body, maybe don't just picture deep-sea divers right away. Think about, I don't know, shaking up a soda bottle, pop the top too fast and fizz, bubbles everywhere. Well, something kind of similar, but potentially way more serious, can happen inside us. And it's not just depth, it's the speed of the pressure change.
Exactly. That sudden drop, that speed is absolutely key. It's the basic idea behind decompression sickness, or what a lot of people call the bends.
Hmm.
Essentially, gas that dissolved into your tissues and blood under higher pressure, think nitrogen, it comes out of solution too fast when the pressure drops. Forms little bubbles.
So it's not just a scuba diving thing then.
Oh, definitely not. I mean, coming up too fast from a dive is the classic scenario, sure.
Yeah.
But you can see it with a rapid ascent in, say, an unpressurized plane or sudden cabin depressurization, even coming out of a hyperbaric chamber too quickly. For divers, the risk generally starts becoming a factor around maybe 20 feet of seawater. Altitude-wise, you're looking at maybe 18,000,
Wow.
20,000 feet without proper pressurization.
Okay. And I've also heard the term decompression illness thrown around. Is that different?
That's a good point. Medically, yeah, they often use decompression illness as a broader term. It groups decompression sickness together with some other pressure-related problems like arterial gas embolism, because honestly, telling them apart just based on symptoms can be really tough sometimes.
Right. Makes sense. So, okay, someone has this rapid pressure change. They potentially develop decompression sickness. What does that actually feel like? What are the warning signs?
Well, the symptoms can be all over the map, which is part of the challenge. You might notice something fairly mild at first, maybe a weird skin rash. Sometimes it looks kind of mottled or blotchy, or just feeling generally off, malaise, joint pain, muscle aches are really common too. And that's sort of classic pins and needles feeling, paresthesias.
But I imagine it can get much worse than pins and needles.
Oh, absolutely. The more serious signs suggest the nervous system or other crucial systems are involved. We're talking things like muscle weakness, trouble with balance, that's ataxia, dizziness, or vertigo, hearing loss, difficulty breathing. And in really severe cases, you might see loss of bladder or bowel control. The person could go into shock. And sadly, yes, it can be fatal.
Wow, that's a huge range. How quickly do these symptoms usually appear after the event, the pressure change?
Typically, most symptoms will start showing up within about 1 to 3 hours. The vast majority are definitely noticeable within 24 hours, but, very occasionally they can be delayed even longer.
So with such varied symptoms, how do doctors actually diagnose this? Is it all about scans and imaging?
Actually, no. The diagnosis is mainly clinical. It really relies on putting the story together, understanding the pressure exposure, the dive details, the altitude change, how fast it happened. That combined with the person's symptoms and a good physical examination. Imaging isn't the first go-to because those tiny bubbles can be really hard to see reliably on scans, or they might have already dissipated.
Okay. So you suspect decompression sickness. What's the immediate first aid? What's step one?
Oxygen. That's the absolute most critical first step. High concentration oxygen, as close to 100% as you can get through a well-fitting mask. Also keep the person warm. And hydrated plain water is good if they're conscious and can drink. If not, intravenous fluids might be needed, but ideally avoiding glucose solutions initially. Keeping them lying down, horizontal, is generally helpful too.
And then the main treatment, the sort of gold standard.
That would be hyperbaric oxygen therapy. Essentially, you put the person inside a special chamber, increase the pressure around them, and have them breathe 100% oxygen. Breathing that pure oxygen under increased pressure does two main things. It helps shrink the gas bubbles causing the problem, and it floods the tissues with oxygen, which helps areas that might be injured or struggling.
Huh. So you're basically using pressure again, but this time to fix the problem caused by the pressure drop.
Exactly, recompression. And it's considered highly effective. Cost-effective, too, because it can prevent really serious long-term damage to the spinal cord, brain, nerves. And it saves lives. It carries a Class 1 recommendation, which means it's strongly advised, based on level of evidence C.
Right, and level C often means it's based on expert opinion or case studies, maybe because doing big randomized trials is difficult for ethical or practical reasons in these situations.
That's generally the interpretation, yes.
So wrapping this up for everyone listening, even if you're not planning on diving deep or flying high anytime soon, it's pretty fascinating, isn't it? Just understanding how these invisible pressure forces around us can have such a dramatic effect when things change too quickly. Knowing the basics, that it's tied to rapid pressure shifts, the wide range of symptoms, and that oxygen and hyperbaric therapy are key, that knowledge could potentially help you or someone else in a pinch.
It really does make you think, doesn't it? About these fundamental physical laws we usually take for granted and how powerful their effects can be physiologically when the balance shifts rapidly.
Definitely. And kind of leaves you wondering, what other environmental factors, things we barely notice day to day, might be subtly impacting our health in ways we haven't quite figured out yet? Something to ponder.